Good afternoon, everyone, and welcome to our weekly press conference. And for our visitors in the room, you may notice that the room shrank. Since our last meeting, there's actually voting going on, so that we did start that process as of yesterday. We'll go ahead and kick off the meeting. We have Dr. Beam from IU Health on our left, Mayor John Dennis, Dr. Jeremy Adler from the Health Department. I'm Commissioner Tracy Brown. Mayor Rosworski joining us, and Dr. Daniel Wickert from Franciscan Health. So with that, we'll go ahead and start things off with Dr. Adler.
Okay. Thank you, Commissioner Brown. Good afternoon. Thank you, everyone, for attending today. The U.S. is quickly closing in on 100,000 deaths from COVID-19. Here in Indiana, over 1,800 Hoosiers have died from COVID-19. With 32,000 cases of COVID-19 in the state. As of today, here in Tippecanoe County, we have 380 cases of COVID-19. Our deaths remain at 3 due to COVID-19. Our age demographic of 20 to 29 and 30 to 39 remain our highest incidence group for COVID-19. Locally, we have tested well over 6,000 individuals for COVID-19. As I've discussed before, the Health Department is monitoring several data points in regards to our COVID-19 pandemic. The first of those, of course, is the number of confirmed and suspected COVID-19 cases in our county. And one way we've been looking at that is to look at the average daily incidence of new cases by week. As many of you are aware, if you look at the daily confirmed case numbers for our county, you'll see those numbers do go up and down. They fluctuate from day to day. So one way of looking at these numbers is to look at the average daily incidence of new cases by week. And so if we look at that figure going back to mid-April, and then following it forward from then until now, we see that number went up significantly at the beginning of May to 12.9, and since that time has gradually dropped. For the week of May 8th, it was 11.0, May 15th, 9.4, and thus far this week, 6.8, although this week is not, of course, over yet. And in addition, we had the holiday weekend where the Indiana State Department of Health Laboratory was closed for a part of the holiday weekend. So our numbers may be lagging behind a little bit. As we've reported before, the percent positivity of COVID-19 tests here in our county remains favorable when compared to the state and national figures. Here for our county at 6.2%, statewide 13.8%, and nationally 7.9%. In terms of the number of hospital admissions and intensive care units for COVID-19, those numbers have remained fairly stable, and we have availability of space in our hospitals, intensive care units, and availability of ventilators. We've also been tracking the number of emergency department visits for respiratory illnesses. This number has decreased when compared to April. Last week it did increase a little bit to 167 emergency department visits for that week. So far this week, it is at 134. Of course, the week is not over yet, so we are seeing fewer ER visits for respiratory illnesses than we were in early April. And the last data point, of course, is the number of deaths that we have locally due to COVID-19, and that figure, as I stated, remains at 3. So we are seeing some favorable indicators. Of course, we are still, seeing new cases of COVID-19 every day. And as we've stated before, it's very important for all of us to remember that as our community reopens, we absolutely must remain steadfast and vigilant in our approach to this pandemic, and we must be smart, cautious, and act responsibly. So all of us must continue to maintain a social distance of 6 feet when in public settings, wear face masks when in public settings, especially in crowded places where social distancing is difficult. We need to frequently wash and sanitize our hands and disinfect commonly touched surfaces. We need to limit our social gatherings as directed by Governor Holcomb. Currently, at this stage in the Back on Track Indiana plan, social gatherings of up to 100 people are allowed while following social distancing guidelines. In addition, it's important to remember that individuals age 65 and older and those with high-risk health conditions should remain at home whenever possible. Businesses that are reopening or have reopened should modify their operations and their workplace environments to optimize social distancing and protect customers and employees. Businesses also need to establish plans to regulate customer capacity per Governor Holcomb's directives, which currently state 75% capacity or 50% capacity in mall common areas. So it's very important for all of us to not let our guard down now. We do not want to endanger ourselves or others, and let's not undo everything that our community has accomplished to lessen the impact of COVID-19. As I mentioned, as our community and our state and our nation reopen, it's very important for all of us to remain vigilant and do the right things to keep the COVID-19 impact as less as possible. There are many models of COVID-19 predicting the numbers of deaths here in Indiana. There are actually 16 models currently that show that the deaths predicted from COVID-19 through June 15th could range from between 2,000 to 4,200 statewide. The World Health Organization on Monday did issue a statement advising, warning countries, even with declining rates of COVID-19 infections, that those countries could still face an immediate second peak if they let up too soon on their measures to halt the outbreak. So again, very important for all of us to remain vigilant and keep doing the right things. Last week, Governor Holcomb released his executive order regarding Stage 3 of his Back on Track Indiana plan. Stage 3 began on May 22nd instead of May 24th. It did contain some key changes from the previous information released about what Stage 3 would entail. Some of those changes include that movie theaters and other theaters or concert halls are to remain closed. Bowling alleys and skating rinks are to remain closed. Playgrounds are to remain closed. Youth day camps are allowed to open on June 1st. However, overnight camps are not permitted. Adult daycare centers may open on June 1st, and community recreational sport leagues may resume practices but not games. The Tippecanoe County Health Department did release guidelines for community recreational sports. These guidelines can be found on the Health Department's website and also the Health Department's Facebook page. And lastly, I wanted to inform everyone that the Indiana University Fairbanks School of Public Health will be starting phase 2 of their statewide COVID-19 study. This is the research project that involved testing randomly selected Hoosiers for COVID-19. They'll be conducting the second phase of their research study throughout the state of Indiana. They will be testing individuals, randomly selected individuals in Tippecanoe County from June 3rd to June 5th at Ivy Tech. That concludes all of the remarks that I had for today. At this time, I'd like to invite our panelists to provide.
Well, thank you. At Franciscan, just to give you a little update of where we're at, we currently have, as of this morning, 12 individuals who are positive, who are in the hospital, along with 16 individuals who are suspect or rule out or under investigation. The good news is that we only have one individual on a ventilator at this point, and we have seen decreased use of ventilators and other support measures besides ventilator use, so we're very happy about that component. Overall, emergency room and general hospital population has picked up as individuals seem to be returning to the hospital with significant problems. When I talk to the emergency room physicians at this point, they tell me that those individuals coming to the emergency room are quite sick, and the individuals that really aren't very sick still aren't coming, but people we see in the emergency department typically tend to be quite ill as we see them. We continue our plans to open up and to advance our services both in surgery and invasive procedures, cardiology, sleep studies, across the hospital, radiology. We continue to look at how we're doing from a testing standpoint, the ability to test individuals prior to their procedures, and also the use of and how much personal protective equipment that we have. We just received a recent study that looked at our usage as a system, Franciscan healthcare system, from 2019 compared to the 2 months of March and April. A fascinating study looking at, it says, well, you used protective equipment last year, and the answer is yes. The challenge is we looked at 2 months and projected that out for the whole year. And our increase in use of like the N95 mask, which everyone has had so much discussion, our usage over those 2 months increased by over 450%. So that's why we really have to keep track of where our PPE is, because we are just using so much more with the individuals who are suffering with COVID-19. Our use of a regular surgical mask went up 353%. Use of face shields and goggles up 344%. So we continue to look at that very carefully and make certain that we have appropriate personal protective equipment for our staff to keep them safe, as well as with our patients. So that was my comments. Thank you.
Thank you, Dr. Wickert.
Well, thank you. I'll go next if that's okay, Tracy. Absolutely. Just a couple things. I want to start a little bit with Parks and Recreation and then move into City Hall. As Dr. Adler said, playgrounds did not reopen, but some outdoor recreation has reopened per the order. So we want to just reiterate that to folks that the playgrounds are not open. I know that was a little confusing over the weekend with some things opening and some things not, but as the order came through, playgrounds are not open. So we would ask people to certainly abide by that, and our park staff is working very hard to keep up the yellow caution tape and remind people that the playground piece is not open yet, and it's important that we follow that rule and make sure that we're abiding by that. So we want to make sure that everybody help keep that word out. City Hall did reopen this week on Tuesday with some restrictions. Most of you may know that we are open from 8 to noon. At noon, we close from noon to 2 for a thorough cleaning of the building. We're wiping down all of our countertops, our handrails, places where the public might touch when they come in, and so we are using that 2-hour window there to allow time for all of our staff to clean their workspaces, to clean all the counters, and then we reopen the building at 2 o'clock and then close at the normal time of 4:30. In addition, all our employees are taking their temperature as they come into work. We have about 30 or 40 thermometers spread throughout the city. Police, fire, Cindy's office, my office, everybody's taking their temperatures. Masks are required for city employees when they leave their workstation and walk to another area, and also required when they are interacting with the public. So we have X's on the floor where we would like you to stand. We have chairs in certain places to create aisles that we want you to walk through so we don't combine two spaces and we limit the contamination areas within City Hall. And so far that has went well. We have not had a large onslaught of people, but we have had a few people come into City Hall. We would ask, it is a recommendation, if we need to make it mandatory, we will, that you wear a mask when you come to City Hall. We're getting marginal participation with that right now, but we would really like to encourage you also, if you do come to City Hall for business, to please wear a mask so our employees and you both have masks on during those interactions, even though we're working very hard to keep that at 6 feet and to keep everybody separated. Utility billing is not open. As I indicated, it will open maybe on the 14th. We haven't decided yet. We'll continue to watch the data and the numbers that we feel that's our greatest area for potential people to be too close. We have installed tempered glass in those areas now, so when this is over and going forward, we'll have tempered glass in locations that should help with that. So we feel overall what we're doing is working. We're able to keep everybody safe. We have good cleaning procedures. Our employees know the guidelines that they're supposed to follow, and I think that we're making good progress. We also are requiring for our employees so that citizens will know that are traveling over the summer. If they go to certain locations outside the country, they still will be required to quarantine themselves for 14 days when they come back. If they travel to a city that has a spike or certain levels of COVID in it, they'll be required to quarantine for so many days when they come back to make sure they're symptom-free before they come back to work. So we have put a travel policy in for our city employees that you'll be interacting with over the summer, depending on what part of the country, what cities they would travel to, even in the United States. So I feel like we've got good processes in place to try to keep them safe and to keep, as our citizens re-enter back into City Hall, creating as safe as environment for them as possible. So, thank you.
Thank you, Mayor. We, in county government, this building that you're in now actually opened yesterday. It was our first full day open, and that has continued in county facilities across the area, with the exception of the county courthouse and the 111 building that houses the public defender's office and our county prosecutors. Those buildings will open up on Monday to as close to normal use as we've been at throughout this emergency. Keep in mind, and I want to address the topic because my phone is absolutely rung off the hook for probably about the last month about recreational sports. If you think that baseball, swimming, football, you fill in the blank, is going to look like it ever has before, that's an unrealistic goal at this point in time. I've been a coach for a long time, and we preach safety first in everything that we do, and the COVID emergency really isn't any different. The guidelines that Dr. Adler released last week are coordinated with the governor's guidelines for the shift in stage that went into effect on the 21st. And these aren't things that we just sit around and dream up. These come from the best information available, and we are learning new things almost daily. We've all seen what has changed with masks. Wear a mask, don't wear a mask, wear a mask. My recommendation, our recommendation right now is wear a mask. It's a layer of protection, as is social distancing and many of the other measures that we put out. So believe us, we all want normal, even if it doesn't look like baseball, but we want to keep our children as safe as we possibly can. So.
Thank you.
Well, West Lafayette's pretty much the same as the other two governmental entities. We're opening up. The unique thing that we have is that we are now in an old school building, and that allows for us to have a lot more separation between the public and some of the offices. We also have hung probably 100 sheets of plexiglass in between workstations. And again, a lot of that's because of the space that we're utilizing. Prior to COVID, we had just one great big, we called it the Thunderdome, one great big communal area where a lot of departments were basically cooperating from. Since that time, we've hung the plexiglass and segregated that out. So it is not accessible to the public. And again, because it is an old school, it allows for us to really have a lot of control with a single point of access and egress. We, again, and this sounds like we're all basically following the same protocol, but unless you've been asleep for the past 15 years, you'll realize that local government here does work very collaboratively, and we do use a lot of each other's wisdom to assist us with some of our problem solving. But we still are following the same protocol about distancing, even to the point where we're having some really neat masks made. Go figure. Yeah, I see you laughing, Wilkins. So, but it really does allow for us to try and communicate a very serious message, but do it in a way that's going to keep morale up. Our citizenry has done an amazing job in doing everything that they conceivably can online. The volume of human traffic that's coming into the building is at a minimum. And I think for all of us, that is a great relief. The outdoor stuff, our parks and recreations operations are going smoothly. Our camps have started this week. When you're dealing with kids between the ages of 4 and 14, there's a lot of interesting challenges that come in to that. Again, thank God that I'm not a camp counselor, right, Tracy and Tony? But it does allow for us to be aware to take some things and change some things and sort of operate on the fly with what some of the kids are actually teaching us. The other thing is that with the understanding that we have been involved with COVID now for at least two solid months of absolute restrictions and modifications of policies and protocol, there is some, and it's only natural, there's some degree of comfort coming from our citizenry that isn't necessarily appropriate. We are seeing things like people running and sharing a water bottle. We're seeing things like, different things that went on pre-COVID that's going on currently. And for us, that creates a challenge because what we don't want to have happen is police officers pulling people over for COVID violations. So the best thing for us to do is to remember all of us are in a position of authority. All of us have access to our wonderful media to make sure that the message is continually repeated. It ain't over yet, so don't relax. We need to continue with the discipline that is required of us to make sure we put this thing to rest. It will not be stopped until we either get a vaccine or if we all learn to maintain the necessary protocols to get this thing over with. We've been doing great so far. I think as a community, would compare us to other areas, we've been doing amazing. I recently came back from a motorcycle trip with an old police buddy of mine. And the systems in place down south are much different than the systems in place here. And all I can tell you is that I think if there's going to be a map of how the end of COVID progresses, it's going to progress from north to south. And that has no backhanded slap against anybody that lives from the south, but it's just that there is a different understanding of how it's transmitted, a different understanding of protocol, and a stronger sense of willingness to get this thing over with, at least in areas that I'm familiar with. So, one statement to the community, keep up the good work.
Thank you. Dr. Bean?
Yes, on behalf of IU Health Arnett, just an update. We, similar to Franciscans, continue to be seeing more volume in our hospital because of our efforts to allow and welcome back elective cases. And so that's part of what we're dealing with. Our current volume of COVID patients is we have 5 patients in the hospital with the disease and 7 who are under investigation. And so we are back down into phase 1 of our 5-phase COVID surge plan, which is a good thing. So very much under control. We have adequate supplies and staff and PPE to handle what's currently happening. And just a couple observations over the last few months of doing this. We, like I'm sure every healthcare institution, have learned a lot about preparing for disasters and are hosting and having periodic system-wide, IU Health statewide simulations of COVID disasters, which weekly or every other week kind of test our plan and help us iteratively improve it. So that's one good thing that's coming out of this. The other is healthcare as an organization really depends upon an environment that reduces the likelihood of infections being transmitted between healthcare providers and patients. And one of the things that we monitor is how well are we as healthcare providers performing hand hygiene. And prior to COVID, if you look at the national statistics, 30 to 70% of the time, healthcare providers were reliably washing their hands. It's gotten a lot better over the last decade as we've learned about this and talked about it, but I can tell you COVID has just taken it up to another level where our measurements are above 90% consistently, which is really, really wonderful and a testament to new processes and focus. and the reliability of equipment being available, et cetera. So it's a safer place from that perspective, which is good.
Great. Thank you, Dr. Bean. At this time, we will take questions from the media and from our Facebook Live audience.
Good afternoon. This is Anna Darling from WLFI. Over the past weekend, there was a protest or a rally about renters' rights and making sure our renters are protected here in Tippecanoe County, and it was at the county courthouse. I was wondering what our local leaders are planning to do, if there's going to be any protections in place or extensions of the moratorium on evictions and things like that.
Well, I can start. I mean, we'll continue to follow the governor's guidelines. I don't see us putting any additional individual restrictions on that. There has been some restrictions up to this point. We'll continue to see how those unfold. There has been different organizations working to help with rental assistance. As you know, the city of Lafayette have given out almost $400,000 to small businesses to help keep people employed. I mean, I've always been a big advocate. The best way to do that is through people having jobs and good paying jobs, so they're able to be self-sufficient and meet those needs. And so we're going to continue to work economically to do that, and we'll steer people to the United Way and some different organizations that are helping with that. You know, currently, I think it's fair to say that maybe people lose track a little bit, that through the Lafayette Housing Authority and the voucher program that they have here in Lafayette, West Lafayette, and parts of Tippecanoe County, they currently pay $7 million a year in rent for people. It's quite a large number, and that's not counting the rent we pay for Fresh Start, our other programs that we have that Adam Murphy runs, like Shelter Plus Care, and then the money that it was given to Habitat for Humanity, Faith CDC for affordable housing, and the other rental assistance programs we run. So we're probably close to somewhere in the $9 million a year range that we put towards those types of activities right now, which I think demonstrates that Lafayette, West Lafayette, Tippecanoe County very much value housing as a human right and trying to do everything we possibly can. That's a significant number to ensure that people have quality, affordable housing, and to do the best we can. But for us, I'll be honest, for us to create another pot of money just kind of out of the blue to pay people's rent, well, that's, you know, we're all losing revenue ourselves during this period. And, you know, we use what extra money we could get towards small businesses to help them stay alive so people could stay employed, they could still make payroll and things like that. So, you know, that's the way we're going to continue to look at it and see if there are other options that we can have. But I think it is important that the community knows this community pays millions of dollars a year in helping people with rent.
And we're basically under the same conditions. And when you look at the amount of rental property that we have in West Lafayette, it's significant. And we, from day one of COVID, when Purdue decided that it was going to close, we received a landslide of emails and letters from folks saying, what do I do? I've got a child in school. We paid through the semester. How can we get reimbursed, et cetera, et cetera. And a lot of times, depending upon what the contractual agreement was, there's things that we can do as local government and things that we absolutely cannot do. The other thing is that for the landlords, they're looking at a huge gap in revenue. Again, there's a presumption that if people own 15 houses that they're sitting on a mountain of gold. It's not necessarily so. The houses require maintenance, follow-up, and then again, there's always things that happen that create a financial deficit in some of their properties. We're acutely aware of that, and like Tony said, we do have some mechanisms in place where we're going to be in a position to be able to assist, but for us, it'll have to be on a case-by-case basis. We have the mom and pop shops that have one or two homes, which is something we could look at. Again, we consider those to be a small business. Then we also have the corporate high-rises where there's the similar issue with that. For us to say that we can directly influence rental rates would be a miscommunication. We're not in a position to be able to do that. But when we look at what the market's going to do, when we look at what is inevitable, we know that these students will be coming back. So we know that there will be healing in the future, but for the interim, we're looking what our options are. Same thing with Tony with CDBG funds. We have about $500,000 we're empowered to help small business. Would rental properties be considered a small business? Probably. But there's a lot of things that are coming from the state and from the feds. And we are getting communications at the same time you all do. So the understanding is that I don't think anybody wants this to turn into the next Great Depression. They don't want this to be protracted out for years. So with the assistance that's coming down the pike, the hope is that we'll be able to not just maintain small business with rental properties, but small business, the mom and pop shops in general, and help keep them somewhere close to whole.
Thank you.
Jordan Smith, Purdue Exponent. The governor and health officials, it seemed to be among them, it seemed to be the understanding that when these restrictions were lifted, there would be a spike in cases. Cases per day are trending downward right now. I'm just wondering if that has yet to register or if we've avoided it.
Well, first, we're very happy to see any downward trend in case numbers. And the big question is whether that trend will be sustained or not. And it's probably too early to know that for sure, because you have to remember that the incubation period for the COVID-19 coronavirus is between 2 and 14 days. So, in other words, somebody can be infected and not show any symptoms for 14 days. So there could still be an increase in new cases. We hope there isn't, but there could still be an increase in new cases. So I think the most important message is even with some of the favorable data that we're seeing, it is too early for us to abandon social distancing, face coverings, hand sanitizing, all of the measures that we've been talking about for the last couple of months, because those are the measures that really are our best weapons against this virus. And we need to continue doing all those things so that we increase our likelihood of keeping our new case numbers on a downward trend rather than an upward trend. So I think that's the really important thing for all of us to keep doing. And we will, of course, continue to monitor those numbers very closely and pay attention to those trends.
Ron Wilkins from the Journal and Courier. For the two doctors from the hospitals, Dr. Wicker, you said you had 12 COVID patients as of this morning, 6 possible additional cases, and you, Dr. Bean, said IU has 5 and 7 possible. Is that trending down? What has been the highest number of COVID cases at your hospitals at any one time? And are any of these currently in the ICU?
So our highest, if we add those individuals positive and under investigation, our highest has been in the range of around 40. So we are not at our high point. We are lower than that. But what's interesting is that, and both of us keep track of each other's numbers because we communicate those on a regular basis. And so we'll say, well, IU numbers are low, and then tomorrow they'll have another 5 or 6 that come in. So the numbers do fluctuate to some extent. We'll be up to 32, 33. The next day we'll be down to 27. I mean, it varies, but we seem to be kind of at that consistent level right now and have been for a number of weeks of maintaining that level of consistency, either with when you combine positives and under investigation individuals. Currently, we have only 3 of our positive patients are in the ICU.
So I completely agree that we're seeing lots of day-to-day variation. And our peak was, I believe it was a couple of weeks ago, and we had maybe 30 combined, plus or minus. If you remember, I try to reference the phase of our surge plan, and so we bumped up to phase 3 for about 5 to 7 days a couple weeks ago. and that represented a larger volume, moving ICU patients from into space that's not typically ICU space, but can fully handle that level of care. So for the last number of days, we've also been at our current level of, maybe a dozen plus or minus, maybe up to 15 COVID patients plus patients under investigation. And I don't know how many, I think one or two are in the ICU this morning, to be specific on that.
Question from Facebook Live. Are there any COVID cases in the nursing homes or long-term care facilities in Tippecanoe County?
We are very fortunate in that thus far we have not had any cases in nursing homes in our county. And that has been entirely due to the great efforts of all of our nursing homes in terms of their visitor restrictions and the measures they're taking to monitor their staff and to monitor their residents. So we're very happy that that has been the case so far.
Question from Emily Seiberg from WBAA. Bars and nightclubs are allowed to open at 50% capacity with social distancing guidelines under Stage 4 on June 14th. What potential issues are the health department and the mayors anticipating from the reopening of those specific venues, and how are they preparing to handle those issues?
I got that one first.
Okay.
Well, the presumption is that all of us, specifically adults, are acutely aware of how serious this situation is. The reality of it is there's a certain age group that is absolutely and utterly invincible. Just ask them. And we have done everything we can through education, through meeting, through referencing, providing reference material to all of our bar owners so they understand what the potential problems can be. Obviously, if the circumstances get to the point where they're out of control, we will have to intervene as local government. And that's going to be a gentle intervention, going inside, recommending that the appropriate numbers be adhered to, and then leaving. And should that not be adhered to, should they dismiss that, then we'll have to take a little bit more aggressive action. But the thing about this isn't just a matter of trying to make a quick buck. This is a health issue that has far-reaching repercussions. We are aware of it. The business owners are aware of it. They've been absolutely outstanding up to this point. We had that one little hiccup that was handled immediately and effectively. But our hope is that this is translated to our student population as well. With the actions that President Daniels and his team are taking to open Purdue, with the understanding of how it's going to be Purdue University, but a different Purdue University, I think that will bleed through to not just what they do in the academic world, but also what they do socially.
I think that the big concern, just as it is in any other business or environment where you have people gathering, is social distancing. And so bars and nightclubs will likely need to modify their arrangements, their interior setup to optimize social distancing. And so that's going to be a challenge, as it would be in any setting of that, where you have a crowd of people gathering. So that's something that, we as a health department are happy to provide guidance and advice for ways to make that happen. It's going to differ, of course, from business to business, but that's important to look at ways to optimize social distancing in a bar or nightclub setting.
I would reiterate what Mayor Dennis said, too, for the Lafayette side. First of all, we've been very pleased with the way restaurants and things, in my opinion, have handled this. Many of them did not even open right away when they could have. They took a lot of time to really think this through, the right thing for their patrons and for their employees, and they have slowly opened, and I think the community in general has kind of slowly worked their way back to those restaurants. I don't see them packed like we used to, and of course they're only at 50%, but I think people have done a good job with it, and so we want to encourage them to do that. Opening bars does present a little bit of a unique challenge, and some of the restaurants are bars and restaurants both, and they'll have to do some different things. But we do expect people to follow those same rules, to be very careful about what they're doing. And as John said, so far our police departments have had to do very little. I'm not reminding people here and there, maybe on some activities, but very little. But if we do have a bar situation that's not being adhered to correctly, and we need to step in to help make sure that we bring that under control, we would do that also. It'll start with gentle reminders, and we'll try to really get people to behave properly and to make those good personal decisions themselves. But we also won't let a situation get out of hand that could endanger our entire community or cause a spike or some type of other situation to happen because we have a group or a small group that's not adhering to those rules. And so we will be prepared to take those steps. I hope that we don't need to, but we will be prepared because we have no intention, as we've talked about, of us losing all the ground that we have gained to this point. So everybody needs to take personal responsibility, use some common sense. Let's don't ruin this for everybody, like we used to tell our kids, right? You're going to ruin this for everybody, so behave, and let's step through this properly, and we'll keep making the progress that we're making.
It's no secret that the three of us collectively have come to expect some bad behavior. I mean, that is anticipated, and we appreciate the question. I can tell you, this past weekend, I sat in a restaurant for the first time in weeks, and it was difficult to find a restaurant to sit in because many, as the mayor said, have not yet opened up. But what that told me once I got inside was that these folks, these business owners, not just restaurants, business owners in large part have taken this very seriously and have come up with some pretty creative plans for how they're going to handle the guidelines that have been set forth for them. So it's going to be a process, but we expect there are going to be some bumps in the road too.
Thank you.
Jordan Smith with the Purdue Exponent. I'm just wondering if the county has a system for reporting recoveries from COVID. We have at most a few dozen in the hospitals, 380 in the county, and only 3 deaths. So I'm just wondering how, if at all, do we track recovery?
That's actually a great question, and it's actually turned out to be difficult to do that, mainly because there is not a national definition of recovery from COVID-19. So when you see reports from different states, excuse me, about the number of recovered individuals, each of those states is using its own criteria for recovery. So it's not consistent from state to state. Thus far, the CDC has not issued a national definition of recovery. They have issued parameters for discontinuing isolation among people who have COVID-19. And so the question, of course, is, well, do you consider somebody recovered once they no longer need to be isolated, or are they recovered when their symptoms have improved to a certain degree or when their symptoms have resolved completely? Is recovery after a certain number of incubation periods of the virus? So these are questions that are on everyone's minds nationally, so that we can get a better handle on the recovery from COVID-19. What we have observed is that the recovery from COVID-19 seems to be a lengthy process, lasting often 2 to 4 weeks or even longer. So it's not an illness that people recover from quickly. So once a definition of recovery is available, it'll be easier for us to track those recoveries and report them.
This will be the last question from Facebook Live. What about the use of outdoor restrooms being open in the city for the mayors? Are they going to be open or closed in the city parks?
Well, in the city parks, they are open, but the hygiene, they're continuously being monitored. It's a double-edged sword. Obviously, with some of our parks, the facilities can be somewhat remote, So it's imperative that we provide some form of relief for people that need to use the restroom. They are all equipped with hand sanitization systems and other hygiene equipment in there to make sure that the things are available for people to police themselves. The other thing is that they're routinely cleaned by our Parks Department.
Same thing in the city of Lafayette. We are starting to open them. They may all be open by now or getting close, and we have some enhanced cleaning that will be taking place. But as Mayor Dennis said, again, that's going to be a personal choice for people and some personal responsibility with all the facilities we have. We have over 700 acres of park ground in the city of Lafayette, 19 different parks. We're not going to be able to get to every restroom every 20 minutes or something like that. That is not physically possible for us. And so people need to make good decisions. Again, some of this is personal responsibility, and make sure you wash your hands and do things right, because we're going to do our very best, and we know there's needs for those facilities, but to create an expectation that every 20 minutes we're going to get to all 19 parks with hundreds of I mean, that's just not going to happen. And so people need to take that into consideration and make good choices.
Thank you. At this time, I would like to invite the Lafayette City Clerk, Cindy Murray, who is also the Chair of the Stars and Stripes Committee, to the microphone for an announcement.
Thank you very much. I want to thank you guys, first of all, for doing all you've done to keep our community safe, and the great advice we've gotten from the health department and the staff. I mean, I just hear wonderful things about it, and obviously by the numbers that we're seeing, we're much better off than many other communities, and that comes from the great leadership that you guys provide. So thank you again. So I'm here today to talk about the Stars and Stripes. I know Dr. Adler and I have emailed one night pretty late discussing the ability to have them or not. And after, a lot of sleepless nights and going to the mayor's office, every other day, what do you think, Tony, what do you think? And I've had a conversation with all the commissioners and Mayor Dennis as well, and we are going to cancel the Stars and Stripes this year. Due to the number of people, with gatherings and not being able to gather, and I know that July 4th is the day that we're supposed to be at 100%, but being able to social distance down at Reilly Plaza is just not going to be able to happen. And it's too tempting. I mean, it's a great holiday. Everybody likes to be out that day, the good old, USA and Americana, which we all need right now, but there were just so many factors that just played, just screamed no to me. And one of those two is I would feel horrible knowing that if all those people got together and we as leaders of the community had this event and our numbers went up, and we've done so well, and we've been so vigilant, and I would just feel terrible that our community went backwards and our numbers spiked and more people were ill. So, and early on, the Citizens Band and the Freedom Singers had reached out to me and said that they were not going to be participating this year. And so that was kind of a big factor, too. That was a big light bulb that went off for me. And so then secondly, I thought, well, maybe we can just do the fireworks and ask people to be, vigilant and to social distance. But I think that it's just too tempting for folks not to gather down at Reilly Plaza. It's been such a tradition for all these years. And I thought, well, maybe families could go out and sit in their cars and, be 6 feet apart or whatever. But I just don't foresee that happening with some of the things that have gone on and that you've seen on TV as well. But so this year I think we're going to have to cancel them, and next year we plan on making them bigger and better, hopefully, and we'll be back out there again. But once again, I want to thank Dr. Adler and the staff for being so vigilant and so forthcoming with the numbers that we have in our community. And I would entertain any of the mayors or the commissioners to make any comments as well.
First, I'd like to say thank you to Cindy. I know you did have a lot of sleepless nights, so this was not an easy decision to make, and we worked very hard on that program. But again, like Cindy said, this decision was made collaboratively with the commissioners and Mayor Dennis and Dr. Adler, and we believe as a community it's the right thing to do. Up on the Myers Bridge, people are just going to be shoulder to shoulder, even if we're just shooting off fireworks. There's just going to be no way to keep people apart, and that's just too risky right here at the end of this. And if there'd be a spike or something that would occur a week before, and we'd have to try to cancel, then all of a sudden, quickly, it'd cause a lot of problems, and we'd probably lose some of our finances, some of the things we
Yeah.
paid for and things like that, and that's not good either, setting up for next year. So I do believe that this is the right decision to make, and I think people will understand it, and it's erring on the side of caution, which I think we need to do right now to be sure that we're farther down the line. So Cindy, thank you for all your hard work on this.
Yeah, Cindy, thank you so much. And another point is, year after year, we realize that a lot of the folks that attend this are in the at-risk group. And if we were to start doing something outdoors, this would not be the event to do that with. It's generally in a very tight area, that really plaza, and even the bridge at some point during the night is, like Tony said, it's shoulder to shoulder. And if you look at what we've been through up to this experience, we have done things differently than we've ever done them before. And this is sort of a continuation of that. We'll get through this year. This will eventually stop. We will eventually be greater Lafayette like we used to be, and probably greater than ever as an experience, from this experience. But this is just another one of those cautionary steps that we feel is the responsible step to take. Thanks, Cindy.
Yes.
And if we are still, and we plan on still being on track with the, Back on Track Indiana plan, the governor's plan, July 4th is a big day for us for yet another reason. So I'm very confident that we will all find ways to still recognize the day and the importance of Independence Day for us. But thank you for your work on that. I know that was not an easy one at all.
Yes. Yes, thank you very much, Cindy. I know it's a very difficult decision, but as you can see, we all agree that it's the right decision for the safety of everyone in our community. So thank you, everyone, for attending today, and we'll see you next Wednesday.